My name is Renia Vagkopoulou. I come from Greece, from Thessaloniki, and I've been living in Germany, in Berlin, the last 5 years. I came to this conference trying to bring my experience of Greece during the last 3 years. As you probably know, Greece has been experiencing a very big debt crisis the last 3 years, and in order to overcome this crisis, international help, international economical help has been brought to the country. However, this international help might sound as something positive, but the truth is that the changes that have had to be done in the country, the structural reforms that had to be done in the country, in order for the government to take the bailout packages that they were given to it are huge, and the impacts of them are actually dramatic in the Greek society. So during the last 3 years, the so-called Troika, which is the International Monetary Fund, the European Commission, and the European Central Bank, has given to Greece 3 bailout packages. Each one of them was 130 billion euros. It is important to mention that these bailout packages were taken from Greece with huge interest rates, and the biggest percentage of them, which is more than 90%, were only there to refinance actually the debt. So less than 10% of this money ever reached the Greek community. Not only that, but in order to take this money from Troika, Greece had to the Greek government had to vote for at least 6 austerity packages. These austerity packages were focusing on every sector of the country, and their aim were actually to minimize all public assets and bring them to the private sector. So we have seen reforms in public spending, in privatization, in labor market reforms, in increasing of taxes in every sector, and each package of all these 6 is actually increase of the previous one. So the result and the impact of it in the community is an acceleration of the previous one. What we see nowadays in Greece is a huge increase of the unemployment rate, which has reached 25%. This was the percentage in Argentina in 2001, when the crisis had also broke out. And when it comes to youth unemployment rate, we see a percentage of 55%. Moreover, we see pictures that they were not known so far in Greece, which has been a high-income country, such as a dramatic increase of homeless people, by 25% in the last 2 years. Dramatic increase of people who seek food for their everyday life in soup kitchens. And most importantly, an increase of the uninsured. So far, the uninsured were mostly immigrants in Greece that were coming either from Asia or from Africa. But this picture has totally changed. Nowadays, the people who are uninsured are not only immigrants, but a very big percentage of them are also Greeks, either employed, but their income is so small that cannot cover their basic insurance anymore, or unemployed people. And unemployed people who are under the unemployment benefit for over than 1 year lose their right to access healthcare services, public healthcare services in Greece. This means that more than 30% of the population nowadays have huge problems to access healthcare. And that's why we see new phenomenon of the creation of grassroots initiatives which have been trying to create solidarity medical centers, and they try to provide all this population with basic health care. This is either primary healthcare services, but we see cases of secondary healthcare services and even tertiary healthcare services. What is very interesting in this phenomenon is that a big network has been created throughout the different cities. So such solidarity centers, which actually work only with volunteer doctors, have created networks throughout the city with other pharmacies who provide their drugs for free, or with private doctors who have volunteered to see their patients in the private clinics, or with even doctors who work in public hospitals, and by their allowance they see patients in tertiary healthcare services. It is important, however, that these initiatives cannot cover the basic needs of a whole population. What has to be done is to change the central politics, not only in health. We do not seek a change in the health sector only, but in a general political setting, because only through such a change also the health of a population, a better health of a population, can be achieved.